So the NHPPA is a federal nonprofit that is just there to protect our health rights, but they just happen to have a strong focus on protecting our access to non-pharmaceutical remedies, primarily natural health products. But we've always been the best at kind of looking at what the legal change is, studying it out, and then equipping people to take action. We are going to lose natural health products. The ones that remain are going to become much more expensive, and our natural health practitioners are going to be decimated. I mean, that's in a thumbnail what's coming down the pipe, but this is clearly coming from international trade. This has nothing to do with health, which we would all know anyway. Why would you restrict access to natural products? But this has everything to do with harmonizing Canada's drug regulations with the international drug regulations. So we're going to end up in a couple of years where basically the regulations between the European Union and Canada and other countries are so identical that, getting approved in one will be, it just a formality to get approved to sell in another. And the goal the plan is for them to have one set of regulations for anything that they call self-care products. But one of the points I make is in the discussion paper, and it's a little long because the generation that's fought the other two initiatives, in the late 90s and then 2008 have moved on. And I thought it'd be important for people to understand how low risk these products are. And using a risk analysis, and I include a table at the end, did you know that you are 14 times more likely to be struck by lightning than to be killed by a natural health product? What's happening right now is that Health Canada has published in the Canada Gazette that they're going to impose the same cost recovery that they have for chemical drugs on the natural health product industry. They're predicting that on a yearly basis, except for those fees they haven't costed out, that it'll be an additional $116 million a year imposed on manufacturers and distributors. But the problem is they're saying, well, we're going to use these fees to create a whole new administrative arm to basically be going after manufacturers and distributors because we're imposing much more stricter good manufacturing practices and regulations. And we're going to stop the dissemination of truthful health information. I'll use True Hope Empower Plus as an example, because they actually treat serious bipolar disorder and serious major depressive disorder with a vitamin and mineral supplement called the Empower Plus. But they can't tell you that. Health Canada takes the position, their product is licensed to say supports mental health and well-being, which is completely meaningless to the consumer. But Health Canada takes the position that that's all they can say. So for example, like naturopathic doctors routinely advertise about using vitamin C IV therapy to help people going through chemo for cancer, right? Well, that type of thing is going to stop. So prices are going to go up, and these new regulations are going to drive the small players out of business, and they're going to drive a bunch of medium players out of business. So the end goal is to have, maybe 10 big players standing, the rest of people out of business, because you've arrived at a regulatory environment that is so expensive and onerous that only big players can survive. And those big players will be owned by pharmaceutical companies. I mean, some of the big players already are. So the natural health community has really changed over the last 20 years from small and medium players to big players and medium players and very few, small players. It used to be most of the people in the industry were true believers, either because, their life or well-being was changed by a product or somebody close to them, and then they got heavily involved. Right now, natural health products, there's no limit under our regulations as to what condition they could be approved for. So, I mean, in theory, they could be approved for cancer and heart disease and all of this. It's just Health Canada has made a policy decision because they don't want any serious health condition treated with them. to only allow basically what we call structure function claims. But that's just a political policy decision. It's not the way the law is written. But under the self-care framework, we're even going to be more limited. So we're going to be limited to conditions for which you would not seek the advice of a healthcare practitioner licensed by a province. Well, who's that? We're not talking about medical doctors or nurses because they don't use natural health products. They're talking about naturopathic doctors, homeopathic doctors, nutritionists, traditional Chinese practitioners, herbalists. So if it's for a condition for which you would go to one of these people for, no, you can't be licensed under this new regime. Well, the only other regime is the new drug approval process, which the average cost is about $1 billion. So our products, you already notice now that in grocery stores, in the pharmacy section, you got all the vitamin lines of the big players that are owned by the same people making the chemical ones on the shelves next door. And, so London Drugs and our grocery stores, there's going to be vitamins for sale because for political reasons, they have to be there. It's just they're going to be in amounts that on the label claim. So use vitamin D for an example. Right now, we limit the label claim to 1,000 IU a day. Well, you might as well not take it. That's so meaningless. So we're going to go from a $5,000 maximum fine per offense to $5 million per day an offense occurs. What manufacturer or what practitioner that sells to their clientele is going to risk sharing truthful health information when, one set of charges will wipe them out forever? Like, it's totally unnecessary. So it's truly a train wreck, but it's a blessing in disguise. In my lifetime, the two largest consumer rebellions against the government have involved natural health products. And we had MP after MP after MP say it was the only issue that ever shut down their offices. We have the opportunity to get a large section of the Canadian public very excited, but then secondly, to introduce them to the wider freedom issues. The Food and Drug Act in its current form basically came into being in the 1930s. And it's clear chemical drug influence. We've taken the position under our Food and Drug Act that anything used for therapeutic purpose is illegal. So that's the starting point. It's important to know we've taken the position that everything is illegal. And you can only access treatments that have been approved of by Health Canada. Our drug laws are not health laws. Right. So first of all, you will find nothing in the Food and Drug Act or drug regulations that tasks Health Canada with protecting health or the public interest or good health outcomes. It's a criminal law power. The federal government does not have jurisdiction over health. The provinces do. The Food and Drug Act and regulations is primarily a criminal law act. It has nothing to do with health, and it never has. It's there to protect intellectual property rights. Health Canada is there to enforce the Food and Drug Act and regulations. So the new drug approval process, you want to treat a serious health condition, it doesn't matter whether you're chemical or natural, you've got to go through this process. Well, the average cost is about $1 billion. So the effect is, in Canada, it's functionally illegal to treat any serious health condition with a drug that did not have a patent when it went through the process. So we know the process is to protect intellectual property rights. That's what this is all about, is just to make sure that we really have no reasonable access to any alternatives that work. Because the reality is a letter isn't as effective as a phone call, isn't as effective as an in-person visit. And then when we ask you to go visit your MP, well, we still want you to write a letter, and we'll want you to write a letter to the Prime Minister and the Health Minister and actually any other MP you're willing to do this to. And not just once, do it weekly. Like, we need to, we totally need to create the pressure. We have to build an army, and quickly, that this initiative came from 4 bureaucrats that have no expertise in the regulation of natural health products, but they're tied to international trade. Yeah, so in that way, the industry has become somewhat dishonest because the products have become less effective.